Currently, the issue of alcoholic delirium is quite pressing both in the practice of addiction specialists and in the lives of patients. What is it? Alcoholic delirium, commonly known as the DTs or delirium tremens, is a condition that occurs quite frequently among our patients. It is a withdrawal syndrome from the substance being used, in this case, alcohol, which typically develops around the 2nd to 5th day after stopping alcohol consumption. This condition is quite acute and dangerous because it involves a range of consequences, a number of symptoms, and complexes of organ system disorders that can threaten the life of the person or patient. Alcoholic delirium occurs at the 2nd to 3rd stage of alcohol disease and manifests with a range of symptoms such as disorientation and hallucinations. Hallucinations can be tactile as well as sensory, along with disorientation in space and identity. Various psychoses can also be observed, as well as different aggressive actions, suicide attempts, and attempts to harm others. That's why this kind of symptom complex, this concept of delirium, is very dangerous both for the patient and for those around them. This condition requires strictly inpatient treatment and strictly being in a hospital setting. Because, let me repeat, a patient who is at home in a state of alcoholic delirium can, first and foremost, harm themselves without realizing it or understanding what they're doing, since in this condition the brain is not functioning properly at all. Alcoholic delirium can occur equally in both women and men. The provoking factors that can cause this condition may include a history of certain somatic diseases, such as brain injuries, heart rhythm disorders, or circulatory encephalopathies. All of these conditions can worsen the situation and may trigger alcoholic delirium. Let's say we have a patient who has been drinking nonstop for a week, every day. With a high degree of probability, we can assume that around the 2nd or 3rd day, delirium may develop. Naturally, such patients need to be hospitalized immediately, without waiting for this condition to develop, because God forbid the relatives witness such a state at home. It can be dangerous both for the relatives and for the patient. Alcoholic delirium has a particularly distinctive feature. It can occur for the first time after prolonged use, after long-term consumption of large amounts of alcohol. But there's a particular feature later on, when a person comes out of it, after they've been treated, and then starts drinking again. It takes much less, significantly less alcohol to trigger this condition again. In other words, there's a tendency toward tolerance, a tendency to get used to alcohol, and a tendency for alcoholic delirium to occur more frequently. If this condition isn't treated, sooner or later, the diseases that were hidden or in a latent state in the person's body will eventually come to light. With alcoholic delirium, as I mentioned earlier, a number of symptom complexes arise related to the nervous system. There is disorientation appears, hallucinations occur, mostly in the form of spiders, insects, things crawling around. The body's thermoregulation is disrupted. A person may have a hypothermic reaction, which can lead to kidney collapse, because during delirium, a person's temperature can reach up to 40 degrees Celsius. And we know that at 40 degrees, the entire renal system starts to fail, and a person can simply die. The fatality rate in delirium is about 10%. This can happen because, to put it bluntly, a person in this state doesn't understand what they're doing. They might harm themselves, fall somewhere, jump off something, out of a window, from some floor, and simply die. Or they might harm another person because the cerebral cortex is completely inactive. They don't realize what they're doing. Of course, aside from the fact that this state, a number of diseases can develop as a result, such as kidney failure, heart failure, or cerebral encephalopathy. This condition can only be treated in a clinical setting, in a specialized hospital where professionals work. Treatment involves symptomatic therapy and detoxification therapy. First and foremost, it's necessary to eliminate the person's alcohol intoxication, to carry out a full range of detoxification measures, and of course, to address the symptoms. The symptoms, as I mentioned earlier, include a high temperature, chills, and dehydration of the body. People often experience convulsions, so they need to receive intravenous infusions of saline solutions to prevent this. In addition, the therapy involves the use of a number of neuroleptic or antipsychotic drugs, which will help calm the person in this state and stabilize their emotional background. And a number of drugs are also used for metabolic therapy to support and nourish the person's organs and systems, because against the background of alcohol use, there are often various metabolic disorders, electrolyte imbalances, and liver metabolism disturbances. That's why it's necessary to use large doses of thiamine, vitamin B1. It is necessary to use a range of hepatoprotective drugs, as well as a number of other metabolic medications such as thiotriazoline and several others. All of this treatment is competent and can only be provided in a clinical setting.